Be in the know with unlimited access to IBJ and Inside Indiana Business. Our in-depth coverage of all things business means you'll always be completely in the know. Subscribe for just $1 a week. Get started now at ibj.com/trial offer.
I think one of the things that you should never take for granted is who is cheering for you. And so I have been blessed to be able to have people who will say my name when I'm not in the room, who will tell me about opportunities, and that has been something that has carried me far in my career. Those champions mattered.
That was Tavonna Harris Askew, Executive Vice President and General Counsel of Suburban Health Organization, talking about how she navigated multiple legal career pivots to be in the C-suite of a healthcare organization. And this is IBJ's The Freedom Forum with Angela B. Freeman. Well, Tavonna, thank you so much for joining us here on the Freedom Forum, and welcome. I'm so excited to have you here today, but before we get started, will you please tell our listeners a bit about you, your educational and professional background, and any other factors that have led to you becoming the Executive Vice President and General Counsel of Suburban Health Organization?
Good afternoon, Angela. First of all, thank you for the invitation. It is truly my honor and my privilege to be here today with you on the Freedom Forum. So how would I describe myself? I'd say I am an attorney by training and an operations executive with lots of experience in healthcare, governance, and compliance. I am a proud mother of 4. I have 4 children, 2 sons who are 28 and 31, and 2 daughters who are 15 and 17. My oldest daughter is about to graduate from high school, so that is a moment of joy in our family right now.
Congratulations.
Thank you. I am also a 2-time IU graduate, ho Hoosiers. I went to IU in Bloomington and graduated from the Maurer School of Law. So that is who I am.
All right. So I would like to know, you are a double IU grad, an attorney by training, you said. And when you started off your career path, I wanted to know what you aspired to do, because I find that I am an attorney at this point, but had no clue about what that career path looked like when I started off, and certainly when I was in high school and undergrad. So did you always want to aspire to be an attorney? And if not, were you aware of other career opportunities in your current field or other fields that you had your eye on at that time?
So for the most part, I've always wanted to be an attorney, but I had to buy into it. Initially, it was other people telling me, "Oh, you make a good lawyer," and that was because I asked a bunch of questions. I, wanted to understand how things worked, and I always argued about something, no matter what it was, whether it was what we had for dinner, where, how many times a week we went to church, or whatever the case may be. I always had an opinion about something. So initially it was other people saying, "Hey, you want to be a lawyer, you should be a lawyer." Over time, I kind of bought into that. So I saw some injustices that were happening, growing up in Martindale, Brightwood. I saw lots of things that I didn't agree with happening in my community. And I wanted to figure out how I could give back to some vulnerable populations. I initially wanted to be a prosecutor. That was my life's goal, to be in criminal law. I used to tell people I wanted to be the Black female Blair Underwood. I used to love LA law, and then got my Claire Huxtable vibe because I did love the Cosby Show as well. And so as time progressed, that was the path that I went on. So I ended up going to law school, got an internship in the prosecutor's office, was completely living the dream, if you will. As luck would have it, when I graduated from law school, there was a hiring freeze in the prosecutor's office, and I had to pivot. And so I ended up getting a job at Indiana Legal Services, where I got to practice law, doing some different things, some family law, did do some criminal law, some other areas, and some employment law stuff, and said, you know what? There are some other areas of law that are interesting to me. And so I ended up doing a variety of things there, moved on to UAW Legal Services, and ended up having the opportunity to go back to the prosecutor's office. And so in the prosecutor's office, enjoyed that work, had a great time, doing work there. For me, a lot of people say, well, why did you want to be a prosecutor versus a defense attorney? And I felt like I could make the most difference in the prosecutor's office. I could help set policy. I could make sure people who looked like me got equitable sentences, and that I could be fair, because I saw a lot of unfairness happen when I was growing up. So that was why I wanted to be a prosecutor. And so while I was there, I got a call from a friend who said, hey, the city of Indianapolis is looking for a lawyer who has both criminal experience as well as some general counsel experience. And so applied for a job there and ended up working there for a number of years. Had the opportunity to meet a great woman, Priscilla Keefe, who has recently passed away. And Priscilla said, hey, I'm looking for a deputy general counsel. And I ended up joining Health and Hospital Corporation. And that's when my career in health law started.
Wow. I didn't know Priscilla passed away. I knew Priscilla very, very well. B, that is a heck of a pivot and a heck of a transition. I would have never considered that you could transition from criminal law and prosecution to corporate health law. Like I didn't know there was a through line there. And that's really interesting. So you got your introduction to health law. What did that initially look like? What is health law? What's that mean?
So health law means a variety of things, right? And when you think of a healthcare organization, it is a business that operates just like every other business. There's risk management that happens there. It's a highly matrix organization. So there is compliance, there's governance. You have to set up structures. You have providers, employment agreements, all sorts of things. And so for me, that was the reason why the introduction was pretty easy. I knew how to do contracting. I had done contracting for a variety of individuals. I had done vendor agreements. Hospital needs all kinds of things, from gloves to robots to all sorts of things. But then there's also regulations, right? There's, in a kickback law, START, compliance. And so for me, it was learning the nuances in the laws that were related to healthcare, but knowing how to operate a business and do that governance and operations piece. And so I connected with a number of attorneys in the health law field, spent a lot of time getting some mentorship from attorneys at Hallrender, actually. Sharice Frazier, a wonderful person, a great attorney, took me under her wing early on and let me know what path to kind of go down to learn things about healthcare. And so she was a great role model and example. And so she kind of helped me along. And then met a bunch of other attorneys who were at various firms, your firm even. And then public finance, Brenda Horn taught me some things in that area, a number of individuals. And so learning the nuances of healthcare became pretty easy once I coupled them with the concrete knowledge of how to run a business that I already had.
Yeah. It sounds like you had a pretty strong network to help advise you and counsel you on how to make this pivot and how to transition, which in and of itself is its own benefit in having a network to be able to help you and guide you when you're making some challenging decisions. But I want to know also, as you were making those challenges or in your initial career in healthcare law or health law, what were some obstacles and barriers that you encountered that you didn't necessarily expect, or kind of may have caught you, kind of blindsided you, or just wasn't stuff that you had necessarily prepared yourself for?
Oh, obstacles. There's always challenges, right? So, we already identified the biggest one when I started healthcare over 20 years ago. I had the business and operations experience, but I didn't know the nuances of healthcare. So I had to take the time to learn what healthcare was, right? You kind of asked me that question generally, and I gave you an answer, but I had to learn how the hospital operated. In the organization that I was a part of, there was also a public health department. Had to understand that, had to get in the nuances of learning the long-term care operations, and as well as our ambulance service when I was at Health and Hospital Corporation. A highly matrix organization, and each one had its own set of regulations, own set of criteria, and its own set of leaders, right? And so learning people and what their needs were and how they operated and what their leadership styles was a part of it. Learning the nuances of healthcare law and keeping up while you're learning. You learn it and then it could change, or some of the rules could change along the way, right? And so there are new things, here I remember a part of the role that I had was understanding HIPAA, and here's HIPAA coming along, and then the High Tech Act came. And so there are a few other nuances, not to mention all the changes in Medicare and Medicaid. And, so it is always a constantly changing criteria, working with payers, trying to figure out how hospitals could increase their revenue stream. I think people take for granted the role the lawyer plays in the business. I was blessed to be able to be a part of the C-suite and help set the strategy for an organization. And so I continue to do that today. And then that is probably one of the biggest challenges, is helping to figure out how you manage risk and how you set the strategy for whatever that organization is and continue to increase your payer mix.
Yeah, yeah. That's so interesting. And I think it speaks on and taps into so many things that people don't think about. To your point, when they think about the hospital system or the healthcare system, there's a lot of lawyers behind there making sure that risk is managed, that, regulations and guidelines are followed, that compliance is in the mix. You mentioned some of the people who mentored you and really helped you make that career shift and that career pivot. With that type of obviously beneficial and impactful mentorship in your past, I want to know how you approach mentorship and sponsorship in your own career or the career of others. Now that you're, not just being in the C-suite, but clearly been in the C-suite for years, you must have people approach you all the time asking for you to mentor them. Maybe you still need mentors. How do you personally and professionally approach mentorship, championship, sponsorship?
I would say that I continue to need mentors, sponsors, and champions today. I think one of the things that you should never take for granted is who is cheering for you. And so I have been blessed to be able to have people who will say my name when I'm not in the room, who will tell me about opportunities. And that has been something that has carried me far in my career. Those champions mattered. And I would tell you, I've learned over the years that my champions shouldn't just look like me, whether they're the same race as me, the same sex as me, the same age as me. You want to have a diverse group of people who are actually champions for you. One of the two of the people that I spend a lot of time talking to, try to get together with them periodically, are Deborah Daniels and Elaine Beadle. They have both said to me, hey, let me help you, let me give you some mentorship and sponsorship. And they both have been honest with me when I've needed to hear something different. And so having a diverse group of people has made a whole difference for me. I think, giving back too is important. So when I've heard about careers and opportunities, because sometimes, we get a headhunter that calls, right? That says, hey, here's this job. They're doing their due diligence. And I've actually said to those headhunters, you should call X, Y, and Z. And so that has been, I've been very blessed to be able to help a number of individuals find good jobs, not just an opportunity, but good jobs and good careers. And I think that's important because people pour into me. It's important that I pour into others. And so that is something that I will continue to do. And I think as long as I am working, I'll continue that circle where I will look for people who are good sponsors and mentors to me. I know, like you, many of us have spent many times an opportunity calling Lacey up. Lacey Johnson has been a wonderful mentor and a sponsor to many, many of people in Indianapolis. And so sometimes he probably doesn't even want to answer the phone because we're always calling. But, those individuals have poured into me. And I just hope that as I continue on my career path, that I'm able to be that much of a blessing to others as they have been to me.
Yeah, yeah. I totally, I appreciate that because I'm on that journey as well, always lifting as we climb, right? Continuing to help others as others have helped us, and continue to do that. So when you look at your career trajectory and your success today, I want to know, what do you think makes you so unique? In other words, what qualities or characteristics or skills do you have that you believe really empower you for career success, even beyond clearly the mentorship and the sponsorship always is beneficial, but what are particular strengths that you think you bring to your teams that really sets you apart as a C-suite leader?
I'd say one of the skills that I've learned over the years that I have is I have the ability to identify good talent, right? So if you're looking for an employee or if there's a specific project that you're working on, I think that is a strength that I have. For a little while, I went and did investigations at Cummins. And so I spent some time hiring a number of individuals as I expanded that department. And I hope that Cummins believes that I helped them hire some really good, talented people to work in that investigations department. I always wanted to make sure that I support my people and give them the skills and the tools that they need in order to do a good job. I'd say that I also have some pretty strong strategic legal judgment. A lot of times lawyers are extremely risk averse. You call your outside counsel and they tell you all the reasons why you can't do all the things. And so for me, I am the lawyer who wants to help you figure it out, because I understand that businesses have to operate, they have to run, and they have to make money in order to take care of patients in the case of healthcare, or when I was at Cummins, even in the power industry. So I think being able to have that sound strategic judgment, legal acumen, so that I can help make sure the business moves forward is really something that I'm good at. I'm also good at building, projects, whether it is building a new department or trying to figure out how we implement something. One of the things that I'm most proud of is when I was at Health and Hospital Corporation, we were looking to figure out how we do things different in our health clinics. And so I've had the ability to lead our project where we turned our clinics into a federally qualified healthcare center. And so, being able to have that level of project management to manage multi-disciplines, to make sure that we can come together to accomplish something is something I would say I do well. And just making sure that I listen. I have the ability to do multiple things and listen at once. So, I have ran multiple departments, from our legal department in one place to compliance, helping to build compliance departments, real estate, grants, a number of things. So being able to multitask and not being afraid to try new things, I think that has been a strength of mine. We talked about in the beginning, I wanted to be a criminal lawyer. That's where my bread and butter was. And I jumped into the healthcare field and have been there ever since. So I am willing to learn. Always willing to learn, always willing to listen, and always ready to help move an organization forward would probably be my strengths. And I think finally, whoever my leader is, whether I'm leading or if I'm helping somebody move something along, making sure that I listen to them and help advance their platform, I think is a strength of mine as well.
Yeah, that's awesome, because I really appreciate you acknowledging the leadership skill that leaders must have to not just lead, but also follow, right? Like to make sure that you are promoting and supporting whatever leader that you're working with, or when you're the leader, having that same support from the people who are following you. I think that's an incredible skill that leaders often don't always appreciate, because you get so used to leading and you're not always in the position to follow necessarily. I think that's always a skill to keep crisp. Now it's time for a break.
Thanks for listening to this IBJ Media podcast. You're probably going to remember this ad. Do you know why? Podcast advertising works. 85% of listeners recalled hearing an ad during a podcast, and 70% of podcast listeners have acted after hearing an ad. So whether you're looking to be heard across the entire IBJ Media Podcast Network, sponsor one of our shows, or just start with a 30-second ad, IBJ Media can help. Contact advertise@ibj.com to learn more.
We're back with Tavonna Harris Askew, Executive Vice President and General Counsel of Suburban Health Organization, on this 58th episode of IBJ's The Freedom Forum with Angela B. Freeman. I want to ask about just some practical things about your day-to-day. What do you do day-to-day? And I say that because I think so many times I have executives and leaders and lawyers in particular on this podcast, but people who are not lawyers don't really have a good sense of what lawyers do on a day-to-day basis. So tell us, from day to day, and I appreciate that things change literally day to day and hour to hour often. But what is it that you're looking to do? How are you able to influence your team and make positive change for your organization? And what things have you done at Suburban? I know you've been there a limited amount of time, but what are some things you're proud of already that you've been able to accomplish? You mentioned some of the things that you were proud of in some of your past roles, but what have you been able to accomplish at Suburban that you're already proud of and hope to perpetuate in the future?
Sure. So I would say where I currently am, Suburban Healthcare Organization is the solution organization. We're a membership organization where we have a number of Indiana hospitals and hospitals in Ohio that are members, as well as some tertiary hospitals as well. And so we try to work with our member hospitals to offer them solutions, education, training to help make sure that they're able to stay independent and be able to provide quality health care to whatever area that they're in, right? And so I came into Suburban, and I am the first in-house counsel that they've had. For a number of years, they have wanted to have a lawyer and finally decided to get one, and I am the first. So I am building their legal team, and so I am really excited about that. It is new. It is different. I am getting the opportunity to help them think about things more strategically from a legal perspective, to think about risk, to help them with their contracting, to think about compliance in a different way. And I think one of the things that I'm proud of now is I have been able to do a joint combined compliance affinity group with the compliance officers and in-house counsel in both our Indiana and Ohio hospitals. I pulled them together and offer some education and training and answer questions for them. And that has been a successful piece, in addition to figuring out how I can get some continuing education, whether it's for the compliance professionals or CLE for the lawyers. And so that is one of the things that I'm proud of as that expansion grows. I'm also proud of the relationships that I'm starting to develop with the member hospitals. There are 4 hospitals in particular that I spend a lot of time with, serving as in-house counsel for them in addition to in-house counsel for SHO. And so I am learning a lot. It's helping me be more strategic. And so there are a couple projects of high importance at some of those hospitals. Can't quite talk about them now, but that I am helping move along. And so I appreciate the opportunities that some of those CEOs are now trusting me, that I can have conversations with them and we can talk about what it is that they want to do next. I had a conversation this morning with one of those CEOs, and we were talking about how we could move along the 501c3 foundation. And so I am enjoying having the opportunity to help them think more strategically, how to figure out what to do in their payer mix, and moving things along from that perspective. So I would say those are the things that I'm most proud of. As far as a day-to-day interaction is concerned, I spend a lot of time reading contracts, and there are a variety, whether they're managed care agreements, trying to figure out how we move things along from a value-based perspective. Now, our organization is going through accreditation through URAC for our CIN. And so being able to partner with our CEO and our strategic counsel to advance that initiative is fun. Being able to be on the ground floor of something important, to be able to bring hospitals together so that they can figure out how to be progressive and more innovative in order to deliver quality healthcare to the communities they serve is pretty important and exciting to me.
That's awesome. Sounds like you're doing some really, really good and impactful work, and that's really impressive. I want to know, as you think about inclusion in the space you're in now, particularly healthcare, but just your current role. I know that that changes over the course of time and with the environment you're in and the environment we're currently in and all the things. But I'd like to know, as compared to some of your previous leadership roles, when you think about inclusion in your current role, how has that changed, if at all? And what does that look like for your current role?
So I mentioned, right, this is the first time there's been an attorney at Suburban. And so, people are used to operating the way they always do. And so they're excited to have me there, and they certainly reach out all the time. And so, but sometimes, people are used to doing things the way they're used to doing them. And so sometimes I have to raise my hand and say, hey, don't forget about me. And I will say they're always open. So making sure that I lift my voice to say, hey, I'm here. I'm willing to help. What do you need is important. And I will tell you that sometimes that's not the easiest thing to do, right? Especially when people are moving along for the greater good and they're not necessarily doing things for nefarious or other reasons. So trying to make sure that you always assume positive intent because typically that's what it is, right? People are trying to get the work done. We're a very small organization. And so being small, you never want to put extra burdens or extra weight on other people. And so making sure that everybody that should have a seat at the table has one is important. Making sure that you consider risk management and operations, that's a part of it as well. And even just saying, hey, I'm here, right? And so use me if you will. And so when the organization sometimes is small, you move along and for me, I'm used to big organizations. There's a HR department, there's a legal department, there's all the things. And typically where we are, there's just one. And I will tell you that I have learned so much from this small and mighty team. They've helped me understand that you raise your voice when you need something. You raise your voice to be a part of advancing the mission. And I can tell you that I am proud of that team. The Strategic Counsel and all the members of SHOW work hard each and every day with very limited resources and with a small staff to make sure they deliver quality solutions for the hospitals and the members of our organization.
I'm thrilled to hear that because I've appreciated being outside counsel. I have learned and seen more readily in the last couple years how many large and small organizations are run by very small legal teams. We always assume, particularly as outside counsel, that any major corporation has a major legal team that's running it. And so often, international, global organizations are being run by a very thin legal team. And that must make you even more strong and mighty, to your point, when you all have to have each other's back and check on one another and make sure that, the left hand knows what the right hand's doing and all those things. What has been your biggest difference in seeing, outside of not having the HR department and all that, but being in a slimmer or a leaner organization where you as legal have to insert yourself sometimes as compared to a more structured organization where legal is just part of the workflow?
Sure. So, in a larger organization, you think about, okay, I want an HR representative, I want an operations leader, I want somebody from legal, whoever, whatever relevant business line it is or function, you want to pull them in. You may pull in finance, your CFO, audit and accounting, and you sit around a table and there's 15 people there to solve a problem. You don't have that luxury. in a small organization. In a small organization, you may have two or three, and in that two or three or five or six, wear multiple hats and do multiple things. And so you have to really come together as a team and take the time to dissect whatever the issue is and pay attention to it. And you may have to go back to it a couple of different times. One of the things that I've learned that's different, I could delegate things a whole lot more in a larger organization. Here, I have to do them myself. And doing them myself has given me a stronger appreciation for the work that my teams have done over the years. It has also helped me get closer to the work and to understand the nuances of those legal pieces that maybe I've taken for granted or even forgotten over the years. And so it's made me a better lawyer. It's made me a better business professional. It helps me think more strategically. And so sometimes, in the room, you think when there's 15 people in the room, you don't have to say that or bring up the issue because somebody else will. In a room of two or three or five or six, you have to bring it up because there might not be somebody else that will. And so it is helping me be more thoughtful, to think about the business more, to learn the business more, and to be more of a team player to help make sure whatever it is that I'm working on or whatever it is that I'm doing is done well and with quality, and that I understand the nuances that go along with it as well.
Yeah, I love that. And I fully appreciate why that would be the case. Yeah, that seems like an awesome learning, an awesome opportunity to your point, get closer to the work, not just managing people. I talk a lot about, people who sit in your seat, about your teams and how you're managing people. And you've kind of gone from being that people leader, and you're still a people leader, but a smaller team where you're more boots on the ground. And I can fully recognize why or how that would have you really honing your own skills, not just management skills, but actual legal skills. And that's got to be nice. So tell me about you being a transparent and authentic individual. I know you well enough to know that you are very transparent and authentic in almost every way. But when you go from a much larger organization to a smaller organization, is there more or less pressure in that regard, in showing up as your full self, showing up as your authentic self, really being able and comfortable in being in your own skin? To your point, when you're sitting in a room of 15 people, you may be able to have the luxury of shrinking away a bit because somebody will make the points or bring your specific skill set. When it's just you or you're on the small team, you really don't have that ability. So how have you found being in a smaller operation to allow you or enable you to still show up as your most transparent and authentic self?
So it's funny. I always tell people that is never the easiest thing to do. Being transparent and authentic for some people comes naturally. It comes very easily, and no matter what environment you're in, they can do it with their eyes closed. I will say that is not necessarily who I am. It is sometimes very, very difficult. People stay in one job or one career or with a partner or whatever the case may be because it's easy. They've done it and they have become an authentic version of themselves, right? They can wear whatever that mask is that they put out there very, very well. And so I can tell you, as I've transitioned, I've had a couple career transitions here recently in the last couple years. It has been difficult getting back out there and finding your voice, right? I went from an organization where I could tell you where everything was, from the pencils to the major equipment. I knew how to do everything. I knew about every line of business. And then I had to go to an organization and learn all over again. And so, I remember going through at Cummins trying to figure out how to find my voice. Here I was, been a practicing attorney for 20 years or so, and then, trying to find your voice at this big organization of 75,000 individuals. It was not easy. And so I left after I left Cummins and came over to Suburban, I said, okay, here I'm going back into healthcare. You have to speak up. You have to be that person that you always have. And so I began lifting my voice again, asking questions. And sometimes you have to ask the same question. You may, everybody in the room, especially if you're the new kid on the block, they know all the answers. They know the things inside and out already. And you may have to ask the questions a couple of times, or you may have to do the research. And so, in not being afraid to do that, as I've moved forward in my career, I've gotten to the places where, you can let fear set in even when you don't expect it. And so now I am at this place where I'm at Suburban, and I have wonderful colleagues that I work with. I've had wonderful colleagues everywhere I've been, but I have a group of people who say, hey, ask the questions, right? I have a group of CEOs who are willing to speak their minds, who will tell you what they're looking to get done, and will tell you what problems they have and how they would like things to be done differently. And so because they're willing to be authentic and honest with me, it is opening the door for me to be authentic and honest with them. Every job you have every day isn't beautiful, right? And so you have to be able to say, hey, I need this to be done differently. And so being able to now raise my voice, deal with that fear that we all tend to have, and the things that come along with being in the new role has allowed me to be more of who I am. And then when I don't know what to say, that's when that relationships with your mentors and your sponsors come in again, right? So I have learned to pick up the phone, whether, whatever it is that I'm working on, and say, okay, here's this issue. I need help with this. And, let me run this by you. And so tapping into that network to run some things past them has been incredibly useful to me. And having a wonderful team of support has allowed me to be my authentic self.
I really appreciate that, Tavonna. That's so vulnerable and transparent and authentic. Because I think plenty of us, you are correct, get into a role and you know it by heart. You're used to being the expert in whatever that role is. And then when life happens and you find yourself in a position to need to pivot, whatever that looks like, whether it's transitioning into a new role within an organization, transitioning to a new organization, completely transitioning to whatever the case may be, you do have those same kind of insecurities. And will I fit in? And will I be respected? And will my opinion, and my expertise be able to carry me? All the things that everybody questions at some point in their life and career. And, when you've been in a position to really be at the mountaintop from a professional standpoint and find yourself having to pivot or having to relearn some things or get back into a place where you don't know all that there is to know, I think that puts us all in a position of challenge and insecurity, but being able to be transparent about that in and of itself, and being given the green light to ask the question, ask what you need to ask to fully appreciate and understand what's happening in this particular environment.
Yeah, I mean, I think, we all got to try something new sometimes, right? Whether it's a new restaurant, a new career, a new line of business or whatever, and being able to take the risk is important. And so I realized that, I want to keep working. I want to keep learning. I want to keep growing. And a part of that for me is new career challenges. And so it's not easy and sometimes to try something new and different, but I love it, right? I have been, we talked about my early career. If I would have stayed someplace where, I could have stayed at the city of Indianapolis pretty easily, but, I took the risk, right? I took the risk and learned healthcare, and it has given me a beautiful 20-year career, learning healthcare law and being able to make a difference in communities. And so you take that risk. And it may be a little bit scary, but I think you deal with that fear and let that drive you forward. You figure out how you do new things. You do things differently. I think all of us have an opportunity to do something important in the world. And the last thing I want to do is let fear stop me from doing that. And so I don't. And so it has been something, even, I had a pause. Sometimes you have to repivot, it comes in and now I'm like, okay, I'm moving forward. I'm not going to let fear or anybody else who's in the room doing a thing prevent me from taking those steps forward. I've worked hard. You've worked hard. Others have worked hard. So show who you are, show your skill set, and be who you are, and you can help move forward and advance not only your own career, but you may end up helping somebody else along the way.
Yeah, absolutely. So as we begin to wrap up, I want to know, as you are clearly a leader in healthcare particularly, what can some of our local or national healthcare organizations do to really allow there to be greater access? You mentioned earlier about, addressing the patients and making sure that the hospital, which is a business, is positioned to give the best care to patients, the best care to their consumers, which are the patients. What, as you look forward in your healthcare career, what is it you want your legacy to be? How do you want to be remembered in influencing healthcare in the state of Indiana?
Oh, wow. That's a loaded question. What would I say there? For me, I want to make sure that I help organizations, I help the hospitals that I work with be able to find the financial resources in order to provide good, equitable, and quality care to their patients. I want to make sure that they're looking at the data and the metrics and understand, what social determinants of health are happening with their patients, ways that they can address them, and treat the whole patient. So we can look at that data and metrics and figure those things out. And understanding who your patients are, and those different populations. I want to make sure that there are programs that are sponsorships and pipelines to put new individuals in healthcare. Hospitals and healthcare organizations continue to struggle with needing nurses, needing primary care physicians, and trying to make sure there's a pipeline there. People still want to make sure there are providers that look like them. So, here in Indianapolis, we have CLD that operates its RAWS program, making sure that programs like that are funded, and so that we can continue to produce doctors and people who are interested in healthcare that look that way. I want to make sure we're paying attention to policy. There are all kinds of laws and regulations. There are changes in Medicare, Medicaid that are out there, and making sure we understand that platform and what those changes mean and how it would affect you. Recently my mom has had to go through all the changes, right? She had surgery last year, and we have gone through trying to understand all the different changes that have happened with our Part A and Part B, and whether or not you make too much money and how you do all of those things. And fortunately, we've had some great organizations like SACOA and my own education that can help with that, but other individuals do not. And so wanting to make sure that we put resources around those things so people who are older, who need support, who need health care can get them. So I guess for me, I would say I want to make the healthcare space better than when it was when I got here, that we figure out how we can get some more increased funding, that we can look at new and innovative ways like at SHOW with our clinically integrated network, or other places like we did at Health and Hospital Corporation by getting a federally qualified healthcare center. So I want to make sure that we continue to have a vision and move things along, and so that I've done a part to help us manage risk and make sure that we treat the whole patient, and understanding that legal has a role in that.
Yeah, thank you for that. I guess my final question would be, do you have any advice or suggestions for other healthcare leaders in the city to ensure that we're doing just what you said, which is ensuring that we treat the whole patient, make sure that there is equitable health care within our city and our state, and making sure that no one gets left behind in our healthcare system?
I would tell you, consider organizations like SHOW. It is a wonderful solutioning organization that, we offer services and help with contracting. We help with IT services, with patient data matching, credentialing, hiring. We do a variety of services that are beneficial to a healthcare organization. I mentioned that we have our clinically integrated network, and it's also an opportunity. So consider organizations like SHOW to help advance your platform. For individual leaders, I would tell you we need to have conversations and talk with each other to make sure that we're moving things along and that we are figuring out where the best talent is and pulling them into our organizations. And so, things consistently change, whether there are policy changes, regulation changes, or laws, and making sure you're keeping abreast of that and making sure you train not just at the top, but all the way down into your organizations. And typically, other than routine doctor's appointments, people end up having an experience with the healthcare system because it's not a good experience. So I would say making sure that we practice kindness in healthcare, that we treat the whole patient, and we even have some concern for the caregivers that are coming in, I think will make a world of difference as to how we move healthcare along. Most healthcare organizations at this point have social workers and teams of individuals to support families, and making sure we pour more money and time into those resources, in addition to making sure we figure out ways for our organizations to get a diverse payer mix makes a world of difference.
Tavonna, I thank you so much for being here. Thank you for all your education and information about healthcare law, and how we as Indiana can continue making our healthcare organizations more equitable, more inclusive, and more poignant and positioned to take care of the whole patient. Thank you so much for being on this episode of the Freedom Forum. Thank you.
Thank you for having me.
Thank you again to Tavonna Harris Askew, and thanks to you for joining us on this 58th episode of IBJ's The Freedom Forum with Angela B. Freeman. Please come back next month for another conversation about diversity, equity, and inclusion in the Central Indiana business community.
I'm Tiffany Souter, mom of four, wife, entrepreneur, and host of the Life of And podcast. For years, I built my life with brute force, a successful business, a growing family, and absolutely zero margin. I was tired, snappy, and felt constantly behind, and I was too afraid to admit it. Everything changed when I stopped trying to do more and started building systems that actually worked for my real life. If you too are craving more peace, more presence, and just more time for you, I'd love for you to join me on the Life of And. Subscribe now on your favorite podcast app or listen at ibjpodcast.com.
The IBJ Media Podcast Network is the soundtrack of a growing state. Indiana is on the move, and you can hear it happening on the IBJ Media Podcast Network. We bring you the voices at the center of our economy, our courts, our companies, and our communities. Subscribe now and be part of the conversation that's building Indiana's future. Find all of our shows by searching IBJ Media in your podcast app or visit ibjpodcasts.com.